when Hulk Hogan, The Rock, Stone Cold Steve Austin, WrestleMania 30, and...
On July 24th, 2025, the world of professional wrestling was rocked by the news that Terry Gene Bollea, better known by his ring name, Hulk Hogan, had passed away at the age of 71. Official reports from outlets such as TMZ, the U.S. Sun, and People confirmed that the legendary performer succumbed to cardiac arrest at his Clearwater, Florida home. While many fans believed that years of grueling surgeries and the physical toll of his career were the culprits, recently surfaced footage suggests that Hogan's final moments were far more tumultuous than a simple cardiac event. In this comprehensive 1,900-word exploration, we delve into the wrestler's decades-long health struggles, trace the cascade of medical interventions that marked his later years, and shed light on the shocking sequence of events that led up to his untimely demise. Early health challenges in the 1990s. By the dawn of the 1990s, Terry Gene Bollea's transformation into Hulk Hogan had reached its zenith. Stadiums sold out worldwide as fans chanted his name and admired his near-superhuman physique. Yet behind the scenes, the strain on Hogan's body was mounting. Wrestlers of that era often pushed themselves to the limits, performing several nights a week, executing high-impact maneuvers, and ignoring persistent aches and pains in favor of the spectacle. For Hogan, the relentless schedule and physical toll manifested in chronic joint discomfort as early as 1992. Though still a marquee draw, he began to privately acknowledge that certain moves, particularly those stressing his knees and lower back, left him stiff and sore for days. Compounding the physical grind were allegations of performance-enhancing drug use that surfaced around 1992 to 1993. Under pressure from prosecutors investigating steroid distribution, Hogan took a voluntary leave from the then WWF, today's WWE. While the legal fallout centered on drug possession and distribution charges pressed against suppliers, the rumor mill painted Hogan as emblematic of a locker room culture steeped in shortcuts. Whether or not he personally used steroids remained officially unproven, but the mere association cast a long shadow over his reputation and, as many medical experts would later note, raised questions about the long-term impact of such substances on connective tissue integrity. By the mid-1990s, Hogan openly spoke about locking up after matches, his hips, knees, and lower back protesting every twist and turn, a harbinger of the surgeries to come. Steroid allegations and their aftermath. Though Hogan maintained his innocence, the steroid scandal exacted a dual toll: public scrutiny and accelerated physical decline. In an environment where muscle mass translated directly to ticket sales, many performers felt compelled to seek any advantage available. Whether Hulkamania's poster boy personally partook or was simply ensnared by association, the period forced him to confront both the legal spotlight and the possibility that years of extreme training and heavy lifting had irreversibly weakened his joints. As Hogan returned to active competition by 1994, the repercussions were unmistakable. He no longer moved with the effortless grace that had become his trademark. Instead, each match featured moments of hesitation, a taped knee that buckled under him, a delayed springboard that ended in audible groans from the audience. Yet, business considerations loomed large. WWE storylines revolved around Hogan's heroic persona, and his absence risked plummeting ratings. Reluctantly, he soldiered on, agreeing to undergo minor medical interventions intended to prolong his career. Knee surgeries and chronic pain. The first major turning point came in 1998, when Hogan underwent arthroscopic surgery on his left knee. Cameras rolled as surgeons inserted a tiny camera through small incisions, an early example of surgery for the fans. The procedure targeted torn meniscal cartilage, and initial reports suggested success. Yet within weeks, Hogan was back in intense rehab, reporting persistent pain and swelling. Physical therapists noted that beyond cartilage damage, his ligaments had begun showing signs of fraying, a grim indication that his knee bore the cumulative strain of decades of impact. By 1999, a clean-up surgery under the hands of renowned sports medicine specialist Dr. Fox sought to remove loose fragments and smooth damaged cartilage surfaces. This more invasive operation promised a return to full mobility, but in practice offered little respite. Hogan described a constant ache, likening it to an ice pick in my kneecap whenever he bent down. Despite these setbacks, he made sporadic WWE appearances into the early 2000s, motivated by lucrative paychecks and a desire to maintain his cultural relevance. Fans watching television often chalked his reduced agility up to aging. Few appreciated that each televised comeback masked deeper suffering. Throughout this era, Hogan's training regimen shifted to manage pain. Weightlifting gave way to low-impact cardio, and weight belts became fixtures in the ring. Yet each substitution served as a reminder of what he had lost. The explosive leg strength that once powered his signature leg drop no longer felt dependable. Even mundane tasks like climbing stairs at home triggered stabbing discomfort, signaling that his knees were now liabilities rather than assets. Spinal collapse and the decision for laser surgery. The final straw arrived in 2009, captured in a moment both raw and unfiltered. During his daughter Brooke Hogan's reality series, Brooke Knows Best, cameras documented the patriarch of the family collapsing in agony on her living room floor. Spectators watched in stunned silence as Hogan writhed, clutching his lower back and crying out in pain. Medical evaluations revealed severe degenerative disc disease, spinal vertebrae grinding against each other, nerve roots pinched and inflamed, and bulging discs threatening permanent nerve damage. Typical treatment for such advanced spinal degeneration would have involved extensive decompression and fusion surgery, procedures that carry lengthy recovery times with no guarantee of full pain relief. For Hogan, still clinging to the vision of occasional in-ring returns, that risk was untenable. Instead, he opted for a relatively new, minimally invasive technique: percutaneous laser disc decompression. Marketed as a halfway point between conservative therapy and open fusion, laser decompression aimed to vaporize the offending disc material and alleviate pressure on the nerves. Proponents lauded it as same-day relief, but the reality proved more sobering. While the procedure allowed Hogan to walk out of the hospital under his own power, the relief was fleeting. Within months, the pain returned with a vengeance, this time migrating into his legs, causing numbness that radiated down to his calves. Neurologists cautioned that such symptoms risked irreversible nerve damage. Faced with the stark choice between living free of constant pain but unable to walk unassisted, or pursuing traditional fusion that could grant stability at the expense of mobility, Hogan chose neither immediately. Instead, he continued physical therapy, juggled pain medications, and persisted in a cycle of hope and setback that characterized the next decade of his life. The spinal cord stimulator: hope and disappointment. By the autumn of 2010, Hulk Hogan's quest for relief had reached a critical juncture. After enduring years of escalating back pain, nerve impingement, and episodes of leg numbness, he consented to the implantation of a spinal cord stimulator in October 2010. The device, roughly the size of a pacemaker, was intended to sit beneath his skin in the lower back, with thin leads threaded epidurally along the spinal cord. When activated, It would emit low-level electrical pulses designed to interfere with the transmission of pain signals to the brain. Initially, the procedure appeared promising. Hogan reported a significant reduction in lower back discomfort during the first hours post-operatively, and he expressed cautious optimism in a brief hallway interview. "For the first time in years, I'm not feeling that constant hammering." However, the reprieve proved tragically short-lived. Within 24 hours, his pain returned with equal or greater ferocity. The electrical pulses that should have masked his agony instead seemed to exacerbate it, resulting in intense stinging sensations that radiated from his lumbar region down through his legs. Alarmed, Hogan's medical team readmitted him to the hospital. Comprehensive imaging revealed no device malfunction, no lead migration, and no obvious surgical complication. The most frustrating diagnosis was failed back surgery syndrome, FBSS, a catch-all term for persistent or even worsened pain following back surgery. Clinicians explained that FBSS could stem from scar tissue formation, changes in spinal biomechanics, or ongoing nerve root irritation, all possibilities in an individual whose spine had already undergone multiple interventions. Rather than capitulate, Hogan agreed to have the stimulator deactivated temporarily. This allowed clinicians to determine whether the device itself was contributing to his distress. Yet even when turned off, his baseline pain remained relentless. After a week of hospitalization and exhaustive pain management trials, he was discharged with an unchanged prognosis: chronic, severe back pain with no clear surgical fix. For a man whose identity was tied to putting on a show, the specter of a life defined by unremitting agony loomed large. The 10-hour reconstructive surgery. Determined to pursue every viable option, Hogan elected to undergo a radical reconstructive surgery in December 2010. The 10-hour operation aimed to stabilize his spine, correct alignment issues, and decompress pinched nerve roots. Surgeons performed an extensive multi-level fusion, harvesting bone grafts from his pelvis to reinforce the vertebral segments and installing titanium rods and screws for structural support. Intraoperative neuromonitoring sought to safeguard against additional nerve injury, while vascular surgeons stood by in case of unexpected bleeding complications. Postoperative reports from the surgical center painted a picture of success: minimal blood loss, stable vital signs, and intact neuromonitoring signals. The Hulkster himself released a brief statement expressing gratitude for the heroic efforts of his doctors. However, the initial textbook recovery masked a brewing storm. Within weeks, Hogan began experiencing a new pattern of pain: sharp, localized jolts around the fusion sites, coupled with muscle spasms in adjacent areas. Physical therapists noted guarded movement, as if Hogan's body instinctively tightened to protect fragile hardware beneath the skin. By March 2011, the veteran wrestler reported that his once solid fusion felt like a wooden plank bending under any strain. Imaging confirmed solid bony integration, but also revealed post-operative scar tissue encasing nerve roots, a phenomenon known as epidural fibrosis. Though the fusion had solved mechanical instability, it introduced a fresh source of neural irritation, thwarting Hogan's hopes for lasting pain relief. Dental complications and further setbacks. If the back surgeries epitomized Hogan's battle with orthopedic interventions, a seemingly innocuous dental procedure underscored his growing vulnerability. In mid-2011, he underwent a routine sinus graft to prepare for dental implants, a standard outpatient affair for most patients. During the surgery, a small metal tack was used to secure the bone graft below the sinus membrane. The procedure concluded without alarm, and Hogan was sent home with antibiotics and painkillers. Days later, however, he returned to the emergency department with severe facial swelling, fever, and excruciating sinus pain. A CT scan revealed that the metal tack had migrated into his maxillary sinus, acting as a foreign body that precipitated a fulminant infection. Urgent surgery was required to remove the tack, debride infected tissue, and restore sinus drainage. The ensuing weeks became a tortuous cycle of packing changes, intravenous antibiotics, and dietary restrictions. By January 2012, Hogan faced a second corrective procedure after lingering inflammation failed to resolve. Oral surgeons lamented that his compromised immune response and scar-laden tissues made routine dental care perilous. What should have been a straightforward augmentation became a protracted ordeal, emblematic of how even minor interventions risked cascading complications in his debilitated state. Forced retirement and the Laser Spine Institute lawsuit. Cumulatively, the orthopedic surgeries, the failed stimulator, and the dental fiasco rendered Hogan incapable of returning to the ring. In mid-2012, he announced his retirement from active competition, an acknowledgement that the body he once draped in yellow spandex was no longer up to the challenge. The decision was framed as a dignified exit, yet insiders recognized it as an unavoidable concession to medical necessity. Just months later, drawn by both grievance and principle, Hogan filed a $50 million medical malpractice lawsuit against the Laser Spine Institute in January 2013. The suit alleged that the minimally invasive laser decompression procedures had been inappropriate for his level of spinal degeneration, and that they exacerbated rather than alleviated his condition. Depositions in the case painted a picture of high-pressure marketing practices, where star athletes were encouraged to choose quick, experimental fixes over established standard of care treatments. While the lawsuit advanced through pretrial motions, Hogan continued to pursue additional treatments, botulinum toxin injections to quell paraspinal muscle spasms, epidural steroid injections for nerve inflammation, and even stem cell-enriched platelet therapies. Each modality brought renewed hope, only to yield partial or fleeting benefits. The relentless cycle of innovation and disappointment would come to define the remainder of his years. The toll of decades of surgeries, 2015 to 2022. Between 2015 and 2022, Hogan's body became a canvas marked by the scars of approximately 25 to 26 surgical interventions. Beyond the spine, he endured knee and hip replacements, procedures that aimed to restore joint function, but introduced foreign materials susceptible to wear and loosening. Orthopedic specialists implanted a rotating platform in one knee to mimic natural articulation, and a ceramic on metal hip prosthesis on the opposite side. He underwent shoulder arthroscopies to repair rotator cuff tears incurred during high-impact moves, plus cataract and eyelid surgeries to address vision-threatening complications. Less visible but equally consequential were abdominal laparoscopies to correct internal adhesions causing chronic visceral pain. Reports hinted at gastrointestinal issues, likely related to anesthesia exposure and prolonged immobilization, leading to intermittent bouts of ileus and malabsorption syndromes. To manage the compendium of pain sources, Hogan relied increasingly on prescription opioids, sometimes taking upwards of 50 milligrams of morphine equivalents per day, complemented by benzodiazepines for anxiety and muscle relaxants for spasms. This regimen exacted a steep price. By 2019, Hogan acknowledged in a rare public statement that he was ensnared in a vicious cycle of pain and dependency. Detox attempts led to excruciating withdrawal symptoms, sleeplessness, tremors, and mood swings, yet discontinuation only heightened his perceived suffering. For a man whose ethos had been strength and resilience, confronting addiction became a humbling crucible. Battle we Liz his spine, correct alignment issues, and decompress pinched nerve roots. The diction and mental strain. Behind the larger-than-life persona lay a man grappling with despair. The relentless pursuit of surgical salvation eroded his faith in medicine and in himself. Insomnia plagued him as pain flared in the smallest movements, rolling over in bed, reaching for a cup of coffee, or even laughing. To quell both physical and emotional torment, he turned to alcohol, breaching a vow he had once extolled publicly, to abstain from drinking during peak career years. Close friends recounted ominous moments, vodka bottles hidden in gym lockers, tearful calls to family members admitting fear of hopelessness, and visits to rehabilitation specialists. A 2020 stint in an outpatient addiction program yielded some improvements. Counseling helped him articulate grief over lost mobility, and he experimented with biofeedback techniques to modulate pain perception. Yet the shadow of potential relapse loomed large, compounded by the knowledge that any reduction in pain medication risked intolerable agony. Partial recovery and lifestyle overhaul. The year 2023 marked a turning point. Between May and August, Hogan granted interviews to Men's Health and Muscle and Fitness, revealing that he had successfully extricated himself from both opioids and alcohol. He credited a rigorous biopsychosocial program that combined cognitive behavioral therapy, structured exercise, and the strategic use of cannabidiol, CBD, to modulate nerve inflammation. The results were dramatic. He shed approximately 40 pounds, dropping from around 300 pounds to roughly 260 pounds, improved his sleep quality, and reported feeling as agile as he had in his late 30s. Under medical guidance, he transitioned to a low-impact fitness regimen encompassing stationary cycling, aquatic therapy, and yoga-inspired stretches. Nutritional changes, emphasizing anti-inflammatory foods, lean proteins, and micronutrient-dense fruits and vegetables, further supported his recovery. While he acknowledged that structural damage to vertebrae, joints, and nerves remained irreversible, Hogan embraced a new chapter defined by maintenance rather than cure. Final days, shocking footage, and discordant narratives. In the final weeks of his life, Terry Bollea participated in what many now view as a valedictory podcast interview. Speaking in a soft, measured tone, he reflected on the loneliness of chronic illness and the fear that surgery itself might be the instrument of his demise. He confessed that no medical advancement had succeeded in granting him peace. "I've fought so hard to keep my body alive, and yet every time I think I've won, something else takes its toll." On July 22, 2025, 2 days before his death, unverified surveillance footage emerged showing Hogan clutching his chest and coughing violently in his Clearwater residence. Emergency medical services arrived to find him pale and diaphoretic, struggling for breath. Official statements attributed his passing to cardiac arrest, a plausible outcome given the physical stressors and decades of pain management medications. However, experts consulted by the U.S. Sun hypothesize that residual anesthetic agents from a June outpatient procedure, coupled with localized inflammation around scar tissue-encased nerves, could have precipitated a lethal arrhythmia. As of now, no public autopsy report has definitively confirmed these conjectures. Legacy and cultural impact. Terry "Hulk" Hogan, Bollea's life arc, from his rise as the charismatic vanguard of 1980s sports entertainment to a frail figure enmeshed in medical litigation, underscores both the heights of celebrity and the perils of physical spectacle. He pioneered the fusion of theatricality and athleticism, turning wrestling into a global phenomenon. Simultaneously, his medical odyssey illuminated shortcomings in athlete care. the allure of quick-fix procedures, the underappreciated risks of long-term steroid use, and the systemic gaps in pain management protocols. His $50 million lawsuit against a prominent spine clinic catalyzed regulatory scrutiny of interventional pain practices, and his candid admissions about addiction shattered taboos within the wrestling community. In honoring his contributions, industry leaders have pledged to implement enhanced medical monitoring for performers, greater mental health support, and alternatives to opioid-centric pain regimens. Conclusion: Hulk Hogan's death on July 24, 2025, closed the chapter on an iconic career that redefined professional wrestling. Yet, the fuller story, one marked by decades of surgeries, unrelenting pain, and personal sacrifice, serves as a cautionary tale. In celebrating his larger-than-life persona, fans must also acknowledge the human being who bore the costs of those legendary feats. As the wrestling world moves forward, Hogan's legacy will endure not only in championship belts and blockbuster arenas, but also in the imperative to safeguard performer health, honor resilience with compassion, and ensure that the pursuit of greatness never eclipses the sanctity of well-being.